Injection frequency when it comes to your TRT. I know traditionally some people like to do just twice a week. There's even some clinicians that'll do just once a week. Any preferences for you or what you prescribe to your patients?
Yeah, I've even seen upwards of like once a month, which I just think is crazy. So something that we've been following that I've followed with myself is doing more frequent administration. I think that is better for the vast majority of people. Just basically, the idea there is to keep levels more stable instead of getting a large spike with that large bolus. So a lot of guys will maybe do 120 milligrams all in one shot, or even worse, like every 2 weeks, they're doing like 200 or something, and just you get a huge bolus. Your testosterone spikes up probably way north of 1,000. And what happens with that is that you get pretty massive SHBG or sex hormone binding globulin suppression. So you get a large spike in free testosterone. Free testosterone can be go through aromatization. So it can be aromatized into estradiol. And so guys will subsequently get large spikes in estradiol. That's why a lot of these clinics are giving their patients, one injection a week, and then they see their estradiol spiked, and then they're chasing that with an aromatase inhibitor. So we find that we can just minimize all of that by doing kind of more like a micro injection, essentially smaller injections, maybe 3 times a week. A lot of times that looks like Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, whatever kind of fits into that person's lifestyle. I have had guys who prefer to do daily injections. They feel like naturally their body would produce small amounts every day. They're right. They feel like they feel a little bit better that way. I personally have never been able to feel much of a difference between, once, twice, or even 3 times. I'm lucky in that I'm not very sensitive to estradiol. And so I don't really get estrogenic side effects. And so I probably don't feel those as much as other guys do. If you're very sensitive to like hormonal fluctuations, I would definitely say more frequent injections. Sometimes there is a need for less frequent though, and that's going to be based off that SHBG that I talked about, the sex hormone binding globulin. So the more frequently you do your injections, or the higher the SHBG is allowed to go, the less frequent, the lower. So for some guys who, for whatever reason, may have extremely elevated levels of SHBG, resulting in low free testosterone and resulting in symptoms continuing even though they have good total testosterone, we may opt to do maybe only 2 injections a week to try to suppress that SHBG a bit. So it's something that we always harp on, get labs, talk to your practitioner, and kind of guide your decision based that way.
Yeah, awesome. And have you seen guys like have be able to cut out using an aromatase inhibitor just simply from going to more frequent injections like that?
Absolutely. I mean, we don't even, I would say maybe 1% of the clients at Merrick utilize AIs. We
Hmm.
rarely need them. For most people, it just comes down to increasing the frequency and getting less of that SHBG suppression and less aromatization that way. So much easier. If you don't have to add in a female cancer drug, it's probably better if you can just increase the frequency.
Absolutely. And then when doing the more frequent injections like that, any recommendations on types of needles or anything like that, just to kind of prevent from any welting or things of that nature?
Yeah, so a lot of people like to utilize the insulin needle, which is usually like a 29 to a 30 gauge. It's a super tiny. So when it comes to needle size, the bigger the number, the smaller, the lower the number, the bigger. I don't know why it has to be confusing like that. It just is what it is. But a lot of people like to utilize the insulin needle. If you're doing micro injections, you're taking a total weekly of like 120 milligrams, which is already a small amount of volume. Divide that by 3, you could really get away with a really tiny needle like that. So a lot of people will utilize subcutaneous injections. That's been a growing trend because it is easier. It leads to less scar tissue buildup. You could even do a shallow intermuscular that way. When it comes to sub-Q versus intermuscular, for me, it kind of just boils down to preference. I would tell anybody doing more like performance enhancing drugs or doing any physique type sport, I prefer deep intermuscular so that you're not getting any superficial welting. These guys get so lean. We've all seen people on bodybuilding stages who have welts around their glutes and their delts, and they get kind of knocked down as far as the coach or the grading. What do you call it? Scoring.
Judging.
Scoring.
Yeah.
Yeah, judging. Yeah, as far as the judging goes, you're going to get knocked down if you have big oil welt. So try to get that as deep as possible. Really is just going to come down to preference. Again, goes back to that SHBG. If you do subcutaneous, you will have less of an effect on SHBG because you get a more kind of slower, stable release into the system rather than intermuscular. It will be absorbed a little bit quicker. In my opinion, though, it really is, that's kind of minutia. Eventually you hit a saturation point if you're doing them frequently enough. And so the first injection, maybe it gets in 5 days versus 3 days. If you do subcutaneous versus intermuscular, I'm just throwing arbitrary numbers out there. But after you hit that saturation point, I think it really doesn't matter.